Hi, my name is Emily. I am a student nurse practitioner. Could you tell me your name and your birthday?
John E. Stepp, January 2nd, 1979.
What brings you into the office today?
Having some abdominal pain
Okay, could you tell me where you're having that at?
around my belly button.
Okay, is it still on your belly button?
Kinda, but it kinda goes into my back.
It's radiating?
Yes.
Okay, could you tell me when this started?
Yesterday.
Yesterday. Um, is it more on the left side or the right side?
The right side.
Okay. Could you describe the pain for me?
It's like a dull, constant aching pain.
Okay, does anything make it feel better or worse?
No.
Okay. And you said it's radiating just to your back?
Yes.
Okay. How would you rate it on a scale of 0 to 10?
An 8.
An 8 right now?
Yes.
Okay. Have you tried any over-the-counter medications?
Tylenol.
Tylenol. How many are you taking at a time?
2.
How often?
Every 8 hours.
Okay. Do you know how many milligrams each pill is?
I'm not sure. I think 500.
Okay. Have you had any of this happen before?
No.
Okay. Are you currently on any medications?
I take Imtrava,
Do you know how much?
200 milligrams.
Okay. Is that daily?
Yes.
Okay. What do you take it for?
HIV.
Okay. Do you have any other past medical history?
I have allergies.
Okay. What kind of allergies do you have? Is it medication?
It is the sulfa drugs.
Okay. What happens when you take sulfa drugs?
I get a rash and shortness of breath.
Okay. Next, I am gonna do an assessment on you. I'm gonna listen to your heart and your lungs, then we're gonna do an abdominal assessment, okay?
Okay.
Okay. So if you don't mind to just stay sitting for me, I'm just gonna listen to you real quick. If you actually don't care to turn this way to face me a little bit, just so they can see where I'm auscultating a little bit more. So now I'm just going to start listening to your lungs. If you don't care to take a big deep breath. And again. One more time. And then I'm going to have you turn a little bit this way. And then I'm going to listen to your lungs again. And just breathe normally for me. Okay. Respiratory rate was 12 times a minute, so which is normal. I don't hear any abnormal breath sounds. Your breath sounds clear. I don't hear any wheezing, any rhonchi, any rales, nothing like that. Everything was clear. And then now I'm going to listen to your heart sounds. Okay, that's aortic. Pulmonic. Herb's point. Tricuspid. And mitral. I'm going to listen again with the bell with my stethoscope. Okay, I hear S1 and S2 clearly. I don't hear any murmurs, any friction rubs, gallops, anything like that. Next, I'm just going to have you lay down, if you don't mind. His chest also looks symmetrical. I'm going to shine a light. If you don't care to raise your shirt up, I'm just going to look at your chest here. I see no abnormal pulsations. And then I'm just going to feel here. I feel no pulsations or bruise over the chest either. And then you can just keep your shirt up to your stomach if you don't care. I'm going to listen to your vowel sounds, starting with the right lower quadrant. Right upper. Left upper. And left lower. I heard all the vowel sounds. They were normal active. I didn't hear anything abnormal with them. They were not hyperactive. They were not hypoactive. I heard them in all 4 quadrants. And now I'm going to listen to your aorta here with the bell of my stethoscope. I hear no bruise in the aorta here. Okay. Next, I'm just going to have you raise your head like you're going to do a crunch, just so I can assess for any herniations or masses in your abdomen, okay?
Okay.
Okay, if you don't care to just sit up, just a little bit. Okay, don't sit up quite that much. Just your head. Okay. I see no masses, I see no pulling of the muscles, and I see no hernia, so you can lay back down now. So now I'm just going to do light palpation, and just let me know if you're hurt anywhere, okay?
Okay.
Okay. So this is going to be your right lower. Any pain with the right side here?
Mm-mm.
Okay, right upper. And the umbilical region here. Any pain with this?
No.
And then the left. Any pain with that?
No.
Okay, now I'm going to do deep palpation. This is going to be with 2 hands, and it's going to be 5 to 8 centimeters deep, okay?
Okay.
So, right. Any pain with this?
No.
Any pain when I did any of that?
Mm-mm.
Okay. I feel no resistance with the abdominal muscles when I was palpating. I felt no masses. I didn't feel anything abnormal. Everything was soft. He didn't feel any pain. Next, I'm going to palpate for your liver, okay?
Okay.
So what I'm going to have you do, I'm going to put my hand under the 12th rib here. And then as you inhale, I'm going to have you take a big deep breath. And then I'm going to palpate underneath your rib a little bit, okay?
Okay.
Okay, so go ahead and take a big deep breath. And exhale. Okay. The liver border felt firm. There was no tenderness there.
No.
Okay. And I'm going to have you inhale again. And exhale. The liver feels like it's about 8 centimeters across. And then I'm going to feel your spleen here. Alright, so the patient's flipped so I can adequately assess the spleen. So with the spleen, I'm going to put my left hand under your left lower rib cage, and then use my right hand to palpate your spleen across the right lower quadrant up to the left, okay?
Okay.
So I'm going to have you take a big deep breath in and slowly let it out. Okay, I'm going to have you do it one more time, okay? Okay, the spleen's not palpable, which is normal. And then next, I'm going to palpate for your gallbladder, which is on the right costal margin at the midclavicular line. Let's see, about costal margin. Okay, about right here. And then if you can just take a deep breath for me, and then I'm going to kind of press under your ribcage here, okay? Okay, and release. Do you have any pain with that?
No.
Okay, so Murphy's sign is going to be negative. And you can go ahead and sit back here like you normally were. So now I'm going to be percussing, okay?
Okay.
So right here is going to be your gastric air bubble, which is resonant, which is normal. And then here is where your liver should be. And the liver should be dull. And then the spleen. Which tympani is normal for the spleen. And then I'm going to percuss all 9 quadrants. Okay, and everything sounded normal there. You didn't have any pain with percussion?
No.
Okay, I'm going to have you sit up now. Okay, I'm just going to hit against my hand here, and then you just tell me if you have any pain, okay?
Okay.
Okay, we're going to start on the left side. And then the right side here.
Oh.
Do you have pain with that?
Yes.
Okay. So he did have pain on this right side where his kidney is. So I'm going to go ahead and have you sit back now. Okay, so I do think you might have a kidney infection. What we're going to do is we're going to do a urinalysis and do some lab work. We're going to do a CBC, BUN, GFR, and creatinine. That's going to check your kidneys. And then we're also going to do a CMP, which is going to check your liver, a CRP, which checks for inflammation, and then a lipase. It could possibly be appendicitis, kidney stones, or your gallbladder. I don't think it's your gallbladder since your Murphy's sign is negative. But with all the lab works and the urinalysis, we should be able to pin it down. Does that sound good?
Yep, that sounds good.
Okay, well hopefully we'll get you feeling better soon.